Now, earlier on, we heard from Dr. Lee about menstrual disorders from the Western medicine perspective. Now, we have Physician Jun Negoro here with us to share with us more about menstrual disorders from a TCM perspective. Thank you for joining us today, Physician Jun.
Thank you for having me.
From a TCM perspective, what constitutes a menstrual disorder?
So a menstrual disorder is anything that's characterized by an abnormal period. So what's a healthy period first? So a healthy period is a cycle that lasts 26 to 35 days with 5 days of full flow of red blood with minimal clots and minimal cramps. So anything that interferes with the duration, the quality of the blood or the frequency of the period cycle, we will consider that as a menstrual disorder.
You mentioned earlier on minimal clots and minimal cramps during the menstrual period.
Yeah.
Now, I believe many ladies, we do experience some sort of discomfort during our menstruation. When does it cross over or transit to become, hey, this is a disorder?
So when patients come to the clinic, I ask them 3 questions. So the first one is, are you bending over in pain? And then the second question is, are you taking painkillers and it's not working for you at all? And the third one is it affecting your daily activities? So if they answer yes to more than 2 of the 3 questions, then that will be a concern. And also if they have heavy bleeding, a lot of discharge, abnormal discharge, big clots, that's size of 50-cent coin, $1, that kind of very big blobs, and also vomiting or fainting because of the pain, then that's something that you want to seek medical attention.
So speaking about these symptoms, right, now that we mentioned that we know what these symptoms are, what are the options when it comes to alleviating these symptoms from a TCM perspective?
So for TCM, we can do weekly acupuncture, also herbal remedies, and also moxibustion. So acupuncture is what we say the qi energy is running in our meridian. So meridian is like our energy pathway. So imagine like a MRT line, right? You have all the lines, different colors of the line that is linked to our organ system. And then each of these lines have MRT stations. So these are our acupoints. So we will target all these acupoints that is to do with our blood and also the flow of energy, mainly on the lower abdomen or also on the inner leg, to get a free flow of qi and blood so that the cramp and also the clots will be better. So that's for the acupuncture part. So in TCM, to manage all these pain, we use tonics, Chinese herbal medication like dang gui, bai sao. So these are angelica herbs, peony, which has anti-inflammatory and pain-relieving active compounds. And these are all very nourishing blood tonics. Because in TCM, we always focus on blood being the basis and the foundation of women's health. So we use dang gui, bai sao, and also some taoren, hong hua. All these are saffron flowers that help with blood stagnation. So to get things flowing smoothly, flow the blood and qi smoothly for lesser pain.
How often do you see patients coming to you specifically for menstrual disorders, like they have irregular periods or they have heavy bleeding, intense pain, or no period for prolonged periods?
Yeah, so we do see some patients like this, but I think most of the time we have women coming in for general wellness, like for gut health. Maybe they have bloating issues, sleep issues, or just stress management. And then when I go through consultation and ask them a lot of their menstrual, how their cycle is, pain, clots, and cramp that we mentioned before, then I find out that they do actually have a menstrual disorder. So that's how we, identify the issue and treat the root cause from there.
So treating the root cause, identifying the root cause and treating the root cause is really key. There are some ladies or women, right, who do not have periods for a sustained period of time. And surprisingly, or many of us could find, yay, that's a good thing, because you don't have to go through any discomfort, no cramps, my period doesn't come for 3 months. That is fine, I feel fine. Does that mean that this is okay and I do not need medical help?
I know it's very convenient not to have period, right?
Yes.
Especially those very active women, I totally understand. But then, having menstrual cycle is being part of women. To have a very healthy hormone in our system. So menstrual cycle is just something that we can see and monitor to see whether your overall health is good or not. So one condition that we see very common in our clinic is also PCOS. It's the polycystic ovarian syndrome or PCOS. So this is when the menses doesn't come very regularly. That's because you're not ovulating at the regular time. So this means your hormones are also out of whack. That's why the body cannot produce enough hormones to stimulate egg maturation, follicular development. That's why you don't ovulate. So all this can lead to other conditions like PCOS is known for elevated male hormone, insulin resistance, all this to do with blood sugar levels. So all this can lead to other health problems also. So no period doesn't mean it's good. I think it's also very important for young girls to understand, to be aware what a period is and to seek help when they really need to.
So just to clarify,
Yeah.
even if I'm not trying for a baby, I'm not trying to conceive, and I'm not concerned about ovulating per se, I should still see
Yeah.
a medical professional like yourself, just to make sure that, hey, I'm having a healthy menstrual cycle and I'm going through a normal ovulation cycle as a woman at my age should be.
Yes. So if you see you don't have period or irregular menses, like even bleeding in between your periods, or
Very little.
or very light, because some women just need a liner, kind of very little flow or a very heavy flow, then all this, if you see this for consecutive 3 months or more, then you should be seeking some kind of help, either from a TCM or a gynae doctor.
Okay, so no pain, no period doesn't mean it's a good thing.
Yeah.
Doesn't mean it's a good thing just because you're feeling absolutely fine. So Physician Jun, what would your advice be for the young ladies who have just started menstruating?
Okay, so for young ladies who have just started, once their menstrual cycle has kind of established, they can track the length of the cycle. So on their calendars, they can mark a circle when their period came, mark the first day of the full flow. That's what we consider as day 1. So if you have like spotting before that, that's not counted as a period. So a full flow is day 1, circle that. And then the next cycle, it should be about maybe 30-day cycle or maybe a bit longer or shorter. And then of course you want to note the color of the period, whether it's bright red or is it very dark, kind of clotty, purplish, brownish kind of blood, and also note the clots, whether it's a small clot or a big clot. So in terms of size, maybe you want to check whether it's like a rice grain kind of small clots, or maybe it's like a 10-cent coin or 50-cent coin or even bigger. So that's what you want to track. And also accompanying symptoms. So like either you have pain, headache, if you have tummy cramp or diarrhea or anything that seems to be not associated with your period, but you have it every time that's linked to your period, then that's something that you want to take note of. So just these few very simple things that you can either save on your app or write on your notebook, whichever is convenient for them.
Hopefully all the young ladies keep that in mind. So thank you so much, Physician Jun, for a very meaningful session that we had today. I'm really glad that we got to talk so much about menstrual disorders. Thank you, Physician Jun.
Thank you.